Welcome back to HealthCare Consumerism Radio. This is Doug Field along with my co-host Ron Bachman. And on this segment, we're talking about certainly a hot topic in the marketplace right now, the whole wellness and the final regs on the wellness and health incentives. And joining us today to talk about this in his company is Victor Adefuye with WellnessRebates, LLC. Victor, good morning.
Good morning, guys. How are you?
Fine. How are you doing?
Yeah, doing all right. It's a nice, beautiful day here in New York, and I'm glad to be on the show.
Yeah, nice to have you here. Well, tell our audience a little bit about Wellness Rebates and what you and your place in this space.
Sure. Wellness Rebates is a consultant to mid-market employers that are looking to design comprehensive outcomes-based wellness programs. The wellness has been, at least in the comprehensive nature, has been a big has made a lot of penetration with large companies. It's made less so with mid-sized companies and small employers, and because it's an expensive proposition. So a lot of small employers and mid-sized employers employ what we call Wellness 1.0 strategies, where they have gym reimbursements, or they provide small incentives for people to take a health risk assessment. We're trying to we figured out a way to bring the comprehensive programming that includes large incentives, technology, accurate reporting to the mid-market.
And make it affordable for the employers to.
Yeah.
Okay.
Yes, absolutely. We've figured out a way to make it affordable for the mid-market, and we're excited to spread it around the country.
What's your read on the current final regulations? To share with our audience kind of your take and what the importance of it is for employers and their employees.
Sure. We're actually really, really excited about the final regulations. We think that they provide the best opportunities for employers to create wellness programs that are cost-effective and that are most likely to produce results. In particular, we like the provisions with respect to outcomes-based incentives. These are incentives where the reward is given for hitting specific health outcomes versus just merely participating in the program. We're really excited. We think that when done properly and when delivered through a comprehensive program that focuses on creating a culture of health, they could really be effective.
Victor, this is Ron Bachman, co-host here. The Institute has long believed that the rewards incentives in particular around outcomes-based, is the right way to go. So I think you're in the right space, and it's very exciting to see organizations like yours and entrepreneurs figuring out how to make that work effectively for the marketplace. The new rules are a little bit complicated, maybe for some of those listening in or listening to us in a podcast. I don't want to get too far into the weeds because that might take a whole hour, but in the whole area of the wellness, my understanding is that there are two big categories that have been defined by the new regulations, participatory and then what they call, I think, health contingent. And under health contingent, there's two categories, activity-based and then outcomes-based. You've talked about outcomes-based. Could you sort of lay the foundation in talking about how these wellness programs could fall into any of these two major categories, and then what's the difference between an activity-based and an outcomes-based under the health contingent concept?
Sure. The traditional wellness program falls under the participation side of the spectrum, and that's, going to the gym and you're getting a reimbursement or filling out a health risk assessment and getting reimbursed for that. So those are the traditional programs that people are familiar with. On the health contingent side of the spectrum, it gets a little bit more complicated. I talked a little bit about the outcomes-based, and I'm happy to get even more into that. But the activity-based is more having to do. Think of health contingent as an outcome, as touching on the physical impact, having a physical impact on
the health status.
Yes, exactly, the health status of the employee. So from a participation standpoint, it would be things like, taking a number of steps within a period of time, something that enhances the health status of the employees to, increase their activity levels, things like that. From the outcomes-based, that's more dealing with the specific health conditions of the individual. So it's things like their biometric results, like their body mass index, their glucose levels, their blood pressure, cholesterol, things like that.
Now, does your program address all those different categories, or is it only focused on the outcomes portion of all that?
We're really focused on the outcomes. As you guys suggested, we really believe that this is the way of the future, because we know what the precursors of chronic conditions are. It's 20 years of ignoring high blood pressure and 20 years of ignoring high glucose levels, or smoking for 20 years, or having a high body mass index for carrying it around for many years, that leads to heart disease and diabetes. So if we believe that if companies can really focus on those issues and get employees to be aware of where they stand, basically know your numbers with respect to those issues, and the incentives are done correctly and delivered within a culture of wellness, we can curb the rate of chronic disease in the United States, which, as most people know, it's chronic diseases are responsible for 75% of healthcare costs in the United States.
What's the biggest change from the way the regulations existed before, the way people were applying incentives to wellness programs versus these final regs? What's the biggest change you think that's been made?
I think the biggest change, which has actually caused a little bit of trepidation on the employer side from reading some of the reactions to it, is this idea that the employer needs to provide an alternate standard for employees who do not reach the biometric results under the outcomes-based model. So, for instance, let's say an employer, and it doesn't always have to be structured this way, but for explanatory reasons, let's say an employer decides that he wants to focus on the blood pressure of his or let's make it the body mass index of his population. He's got a obese population and wants to help address that issue. So he could say, for those employees who have a body mass index under the obesity range of like a 30 or so, you contribute X amount towards your health care. For those of you who are outside of that range, you would be contributing more. But the law now says that it can't just be, here, you got a body mass index outside of the normal range. Go ahead and figure it out. Maybe next year you'll be entitled to the reward. The law now says the employer must create an alternate standard that can also be an outcomes-based standard for the employee to give them an opportunity to reach the reward. So you can say, yes, if your body mass index is outside of the normal range, you're not entitled to the reward unless you can show us that you're taking steps or making progress towards getting into the normal range. So for those who are outside of the normal range, you may make it a requirement for them to, for instance, enroll in a Weight Watchers class and attend 90% of the sessions, or work with the employee's doctor to define a standard that the doctor thinks is achievable within a 6 to 12 month period, like maybe dropping 5% of their body mass. And like I suggested in the beginning, that's exactly what we're so excited about. Some employers are a little bit nervous about this, but I think it really creates an opportunity, because it creates a world where people are either, first, they're aware of their conditions when it comes to these, critical biometric measurements, and for those who are, outside of the healthy ranges, it provides a strong financial incentive for them to take steps towards making progress. And, I'd rather live in a world where the people who are, have unhealthy biometrics are constantly incentivized to, drop 5% of their body mass, or be enrolled in a nutrition program or a weight loss program like Weight Watchers, than the world we have now, where it's kind of like, you're on your own, and you have to figure it out yourself, and we're doing nothing, and healthcare costs continue to go up at an incredible rate throughout the country.
On the outcomes base, which is what your focus is it true that there's one more change that might be important as people are looking at outcomes and the alternatives that you just talked about, that in the past, if you didn't qualify under that, that above or below 30 that you mentioned, that you might have to have a doctor's verification of that, and under the new regulations, I think it's the case that you don't have to have a doctor's recommendation now on the outcomes-based standard. You can just tell the employer, I can't meet it, and then he's got to give you some alternative, and he can't just keep putting into outcomes-based alternatives that you can never meet, and that was one of the big issues that may be still somewhat unresolved.
Yeah, I think that's right, and I think that touches on the point that I was making a moment ago. So yes, the employer does now have to create an alternate standard for those who can't hit those preset goals. But those alternate standards can be, lesser goals that are achievable within the 12-month period and that are directed at addressing the same issue. So there is no requirement that the doctor needs to be involved in this process, but we believe that that's really a best practice, because it's the employee's doctor that can help determine what's achievable for that employee medically within the 6 to 12 month period, and it creates a sense of buy-in, right? So instead of it being the employer saying you need to do this, the employer can work with the employee and his or her doctor to come up with a standard that we all agree on is achievable medically. And I think that buy-in creates the kind of intrinsic motivation that's necessary to produce results.
Victor, this is Doug. We've got about a minute to go, and I want to give you a chance to kind of wrap this to our audience. Give our audience a couple clean takeaways that you'd like to leave them with, please.
Sure. I think the biggest takeaway is that the outcomes-based program provide the best opportunities to control healthcare costs, because they help. They create a world where people are either first aware of where they stand with biometrics, they know their numbers, and that they have the incentive to maintain those numbers or take steps towards getting themselves closer to the normal range. And that employers have an important role to play in the overall solving the nation's healthcare crisis. Employers have 75% pay 75% of healthcare expenses in the United States, so they have a financial incentive to maintain the health of their populations. And it's a competitive issue as well, because it's about the team that you're putting out there on the field. If you have a team that's healthier and happier and more productive, the company is going to perform better in the long run. So we're big believers in the outcomes-based model. We don't think financial incentives are all that's necessary to create sustained, lasting behavior change. It needs to be delivered within a culture of wellness at the organization that's supportive. But at the end of the day, we do think that the future is this outcomes-based model, because it helps people. It has the best chance of helping people and making America a healthier place.
Well, Victor, thank you so much for joining us today, and you have a great weekend. And to our audience, stay tuned for the next segment of HealthCare Consumerism Radio.
Thanks,
Hi, this is Brent Macy, Managing Director for the Institute for HealthCare Consumerism. If you're a solution provider in this marketplace, I'd like to talk to you more about our corporate membership program that will allow you to showcase your solutions